Good afternoon and welcome to Embracing Senior Health, sponsored by Embrace Hospice. I'm Candace Howell, and this is a great show we have for you today. We're talking about some senior safety issues, and this is something that's critically important. We'd like to believe that everybody's great to our seniors, but unfortunately there are some crime situations that do take place, and we're going to address those today. I have some wonderful guests to talk about this that are very familiar with this, unfortunately, in many ways, and have to deal with it on a day-to-day basis. So I have Sergeant Jeff Benton with the Sheriff's Department with us today. I also have Lieutenant John Harrelson with Horry County Police Department, and I have April Harrelson, and she's with Embrace Hospice, and she is the Director of Quality and Education. And so we're talking about how our seniors are affected by crime and scams today. What can you guys tell us about this?
You know, I think that it's certainly becoming a crime that's so, that opportunity that the individuals know that sometimes that seniors aren't totally up to speed on the new modern technologies and the new smartphones and the new way computers work, and also they're taking advantage of very sensitive issues such as deaths in the family, such as maybe home repairs, issues that seniors need done, and they prey on that. And I think sometimes that these individuals give in to some of these folks that come around door to door, making something look way better than what it is. And you guys at the county police see that a lot.
We do. I mean, it's a vulnerable population in the sense that sometimes, as Sergeant Benton said, they're not as familiar with the technology. They don't understand some of the security risks of sharing information online that they do. They don't understand that just because something appears to be legitimate, because an email has Bank of America or their local bank on there, that it doesn't necessarily mean that it's from them. And so they will fall prey to information solicitation that then leads to identity theft or any other variety of crimes.
April, how does this affect the folks that you deal with on a day-to-day basis with Embrace? You see some of these folks, some of these seniors that are affected by these scams. What does it do to them?
We do see it, unfortunately, and they are such a trusting population sometimes that they want to believe that things are good, and you know, they have people coming into their homes and taking care of them, and it really just is devastating to them that someone would take advantage of them. And you know, it affects their health, it affects their mental well-being, it affects their finances. So it can really be detrimental to not only them, but their spouses, their family members that are trying to take care of them. It's really a problem for them.
And a lot of times, it's preying on the bank account and pulling money from them. And I mean, I've been wrangled in one of these scams before. It's not hard to think, oh, there's the logo, like you said. Lieutenant Harrelson, you put that information back in there because you think you're logging back into one of your own accounts, and before you know it, somebody's draining your account. So let's talk about some of the common scams that you guys see in particular so that we can kind of flag them on some of the things that they should be looking out for.
I can tell you that through the Sheriff's Office, one that we're looking at right now is a scam where individuals are calling citizens and advising them they're missed jury duty. Jury duty is very important. You know, if you miss jury duty, that obviously the court's going to call you in and could sentence you to jail time or fine you. This individual is identifying themselves as a deputy sheriff and demanding money because there's a fine been imposed by the courts, which is simply not true. If anything like that, with jury duty, you miss court, a fine need to be collected. Someone with a badge would come to your door with a paper from the court, a warrant from the court, a notice from the court, but never would the Sheriff's Office, the Police Department, any local municipality be collecting money from somebody for a fine for missing jury duty or so forth. And that's one major one we're dealing with right now.
I think the idea there is, what's the proof? And I would love for the folks at home to start to challenge people on some of these things. I think that's the biggest thing. Ask questions. What would you say to that?
I would absolutely agree. The best way to combat a lot of these schemes is to say, okay, well, so if it's a phone call, if it's a telemarketing scheme where they've called you and said, I'm a bank representative and I'd like to get some of your information to check your account, we think it's been accessed. Okay, well, I'll call you right back. It's in the age that we have now, it's very easy to obtain the phone numbers online or in the phone book for your local banking institution. So call them directly. Say, hey, if you'll give me your name, I'll call you right back. I'll get the number. I've got it here at home, and I'll call you back just to make sure you are who you're saying you are. And that quickly would diffuse a telemarketing scheme. Really similar with the email phishing schemes. You can do the same thing. You never want to follow a link in an email, whether it appears to be from a legitimate credit card company or a bank, to do that. What I would suggest that you do would be to log out of that, log out of your email account, go to your web browser and actually go to the website that you know you've used before. It's a trusted site. Go to that site and log in like you normally would. Or again, call that institution and say, hey, or did you guys send me an email? But in my experience, most banks and credit card companies don't do that. They're not going to ask you, they're not going to send you an unsolicited email asking you to log into your account or to provide information like that.
And I think for some people too, it's a password retrieval issue too sometimes. It's as simple as that, they've forgotten the login or the password, and it seems like, but they always ask you security questions, and I think that's really important. I think if they're asking you security questions, then they probably are legitimate, I would imagine. So when we come back, one of the things I want to talk about is how, April, you guys at Embrace really work with local law enforcement and protect the folks that you are working with to make sure that their quality of life is not being affected by some of these scams. And gentlemen, we'll have you dig in a little bit deeper on some of the other scams that you're seeing, and you'll provide some good tips for folks at home so that they don't fall prey to these. Stay with us. We'll be right back. We have much more coming up after the break.
If your doctor refers you to a hospice program, you may continue to keep him or her as the primary care physician. Many hospices ask you to take their medical director, but you do not need to do this. Your doctor can be your doctor through your hospice journey.
Welcome back to Embracing Senior Health. I'm Candace Howell. We've been talking about, with this show, some of the scams and things that affect our seniors. And really what we want to talk about with our great guests today is some of the scams that affect them, and also who's preying on them, I think is the biggest thing here too. So before the break, we mentioned a couple of the scams. And I want to talk a little bit about the home repair and contractors. As we age, we can't do everything ourselves anymore, and we do hire contractors. How are they preyed upon in this particular instance?
There are actually a variety of schemes that we've seen over the years. One that was quite frequent for a few years would someone would show up in the driveway with a load of asphalt in the back of the truck and say, we'll redo your driveway, and give a ridiculously low price on that, and then they would say, but we need a deposit. So depending on what the negotiation was there would be a substantial deposit placed down. They fill in a pothole here or there. Oh, I've got to get some more materials. I'll be right back. And they never come back. They never see them again.
So how do we get around this? What can the seniors do to guard themselves in this situation?
I think that any situation, anybody they want to hire to help to do something around the home, feel free to call the sheriff's office, the county police, or your local jurisdiction, because we can check our county index. We can look through the county index to see if this individual is in there. It's going to show us if this person or company is involved in a lawsuit, anything about them. It may tell us a little bit. Now, if this is someone that's coming from another state, the index may not be as good to be able to find out what their history was in their past. But if this is someone that we are aware of that's doing this over and over and over locally, there'll be police reports from the county police or Myrtle Beach police, whoever. And it's better than forking out thousands and thousands of dollars for that person to never come back.
I wouldn't say that I'm a skeptical person, but maybe a little. So I think I'd want to see their business license. Aren't they required?
Ask for credentials.
Yeah.
Ask for the work order. Ask for a piece of paper that has what they paid for on it. Ask for a business card. Even for healthcare professionals coming in their home, they should ask to see their ID badge. We should have those things available to anybody that we go see.
And I don't think that anybody should be offended by someone asking for that. I think that's the person doing the right thing to protect themselves. So now let's talk about who is actually preying on our seniors. And I think this is where we start to get into some of the scary topics. Who is approaching them and actually taking advantage? It's not just strangers, is it?
Yeah. Unfortunately, the statistics would bear out that in about 90% of cases, it's family members that are victimizing seniors. And through experience, we've seen that, unfortunately. And whether that's because they have the most opportunity and access, I couldn't answer that question, but unfortunately, the numbers support it. They're quite frequently victimized by their own family.
90%. That's a very scary number to look at. So, April, in the break, we were talking a little bit about if we work with folks, you know, and we're in this situation, so maybe it's not family, but maybe it's someone we're used to seeing, how does that affect the seniors as well?
Well, it obviously, you know, affects them in every realm, but the important thing is that they tell someone. They don't continue to let it continue to happen. Now, whether if they have healthcare providers coming in, they need to let us know. Talk to our social worker, talk to our nurse, because we do have those ways that we can contact the police or whatever jurisdiction it is for them and help them make that a little more seamless process. Because a lot of times they just don't want to say anything, and especially if it's someone close to them, they want to protect them. But we can help them with that. We can hold family meetings. We can do lots of things to get the process started.
So if it's someone who already has access to their home, what are some of the things that you guys hear of that are going missing at this point?
Well, you know, unfortunately, the way narcotics are at this day and time, the Oxycontins and those type of pain pills and those type of things in a home would certainly mean something to somebody that had a problem. And if they knew or had access to this individual's medicine cabinet or whatever, you know, people that have these addictions will stop at nothing to break in, to steal, to swindle, to whatever, to get them. And so valuables, whatever they could possibly see or do inside that home, somebody that has an addiction is certainly going to do that.
And I think, too, you start to look at the drug situation, and we want to believe that someone would not take someone else's prescription drugs. But the reality is, if someone has an addiction, like you said, they're going to do what they're going to do. But it also becomes currency. So these drugs become currency, the values become currency for them out on the street. Well, we have a lot more topics to hit. This is a very important show. We care very much about our seniors, want to make sure you're armed with the knowledge that you need to make sure that you don't fall prey to one of these scams. Coming up, we're going to talk a little bit about healthcare fraud. This is a big one, and it's another area where you seniors may or may not be affected. So stay tuned. We'll be right back after the break. You are watching Embracing Senior Health.
Hospice pays for the majority of medications that patients are on upon admission to hospice. We take care of medications from prescription from your doctor to the delivery of medications to your home. We take care of all of your needs with your prescription medications.
We at Embrace Hospice are not only dedicated to our patients and families, but to our veterans. A retired Army veteran with 27 years and my chief nursing officer with 20 years, a retired Army nurse. We believe that veterans deserve the care for what they did for our country at the end of their life.
Welcome back to Embracing Senior Health. I'm Candace Howell. This show is brought to you by WMBF News and is sponsored by Embrace Hospice. We've been talking about some very important situations and issues that our seniors face when it comes to frauds and scams today, and I've got some great guests with me. April, I want to talk to you a little bit about how to avoid falling victim to healthcare fraud. This is one that's really scary because we believe in our healthcare system and we want to believe it's there for us, and that if it's our Medicaid, Medicare number, no one else is going to use it.
Unfortunately, that is not always the case. Those Medicare numbers, Social Security numbers, insurance cards really need to be protected. You know, HIPAA, I think most people have heard of, the Health Insurance Portability and Accountability Act, is really in place for a lot of reasons, and I know it's an inconvenience when you have to sign all those forms and go through all the same processes, but make sure you're being asked to do those things. Make sure your healthcare providers are saying, I need to protect your information. And if they're not, ask them how they're doing that. Don't ever give your Medicare number, your insurance, Blue Cross, anything to anyone without knowing they absolutely need it. And make sure even your family members don't have that information if they don't need it, because that can really turn into a bad situation. And you know, your healthcare providers are generally good at that, but make sure that they're protecting you.
How do you guys see some of this come across your desks? I mean, I can imagine that there's a lot of folks out there that have accidentally signed a blank form or something, or what are the ways that it becomes a legal issue?
Well, I would think one of the ways that folks are often victimized, and it kind of goes back to what we were talking about with telemarketing schemes, is with all the information out there about Medicare now, cold calls from people claiming to either represent Medicare or a subsidiary of Medicare, and soliciting a person's personal information, enough information to then lead into identity theft. And that would be one of the more common things that we see. They get that information and then they run with it in any number of avenues that they can use to obtain financial gain with that person's information. But you also see the cases, unfortunately, sometimes when less than reputable, maybe somewhat legitimate medical facilities either overbill or bill for services not rendered and things of that nature.
I can imagine, Sergeant Benton, that sometimes people are called and they're saying, well, you're overdue on a bill, and I have this bill in front of me, and if you pay X over the phone right now, I'll go ahead and take care of this for you.
Yeah, I'm sure it does happen a lot, and an individual, especially a senior, and he doesn't know any better, may look at this and believe this is some great deal, because the way technology is right now, as the lieutenant referred to earlier, the phone calls, the emails, the text messages, everything looks like it may very well come from a legitimate source. I mean, you can create an email address, you can create a website that will look exactly like your bank's. And sometimes even, us, we could get caught up in it. You could get caught up in it. And so the seniors need to really be careful in who they're paying and what they're paying, and make those phone calls, those necessary calls to a family member, to their banker, to somebody that can help them. But, you don't want to be forking out money that's going into some criminal element's pocket. And if they ever have any questions, just pick up the phone, call us, call somebody.
Yeah, and also too, you can call 1-800-MEDICARE too. That's another place that you can go and place a phone call and just check on what's happening within your own accounts and everything as well. One of the things that we're going to talk about coming up, which is another scary one, is healthcare risks in terms of counterfeit prescription drugs and also anti-aging products. Our seniors are very trusting individuals, and there's a couple more things we want you to know about before we wrap up the show. Again, such great information. I think the biggest thing here is check and balance. If you have a question or if your gut tells you that something just isn't right, I think the biggest thing with this demographic, our seniors, is they're trusting, they're loyal, and if someone tells them they owe some money, they're going to pay it because it's the right thing to do. And we're still in that generation where they're going to do the right thing. And that's going to mean sometimes that they're going to get taken advantage of, and we don't want that to happen. So we've got much more coming up after the break. You're watching Embracing Senior Health. We'll be right back. Stay with us.
At Embrace Hospice, volunteers are the backbone of our care. If you feel that you could provide quality, compassionate care to one of our hospice patients, please call 1-855-OPEN-ARMS.
I'm encouraged that here at Embrace we have several competent, compassionate, spiritual care coordinators that come alongside the patients at the end of their life and help them in their spiritual journey.
Welcome back to Embracing Senior Health. I'm Candace Howell. We've been talking about safety and scams and things that affect our seniors, and we've been talking with some great professionals about some things that you can do to make sure that you don't fall prey to any of these scams. We're going to round out the show with general safety tips, but before we do, healthcare risks to seniors that they need to think about. Counterfeit prescription drugs, chances are if it's really cheap, way cheaper than normal, there's probably a red flag there if you're ordering something online. There's no guarantee that you're going to get what you pay for, so if you're buying it online, you might want to have a pharmacy actually check it out for you. And then fraudulent anti-aging products. This is just terrible. Again, no guarantee that if you buy it online, you're actually getting what you're paying for. Check it with your doctor. Check it with your healthcare providers that are coming in from Embrace. But general safety is a big issue we need to talk about before we leave today. Some of the tips that you want to give the folks out there.
If you don't know something, ask for help. Don't let an individual or the criminal element has time to think about bad things to do to you every single day. They will tug at your heartstrings during tough times. That's what they do. That's how these scams work. If you have questions, if you're unsure, call us.
And what about parking? That's one of the ones I want to talk about. If we're out and about by ourselves, a couple places we can park, Lieutenant Harrelson, tell us where we should be.
You know, really what you need to be conscious of, and not just seniors, but anyone, is make sure you're parking in a well-lighted area. You know, if you have the opportunity, it's always better to park as close to the business or that you're going to be patronizing. There's not as much opportunity to be victimized in that parking lot. But with the lighting there, it's, you know, criminals tend to like to have the dark. They want to cover up their crime. They don't want to be seen when they're committing these crimes. So if you're in a well-lighted area, that truly helps.
And then April, for the ladies out there who might be carrying a bag with them when they're out and about doing some shopping.
Well, I'm guilty. Don't put it in the cart. Don't let your kid hold it. Don't let your grandkids hold it. Make sure it's on your person. Keep it on your shoulder. Keep your hands on it at all times. And keep the wallets and things tucked in deep, not on top. Again, I'm so guilty of that. But just make sure you're really paying attention.
And what about parking? That's one of the ones I want to talk about. If we're out and about by ourselves, a couple places we can park, Lieutenant Harrelson, tell us where we should be.
You know, really what you need to be conscious of, and not just seniors, but anyone, is make sure you're parking in a well-lighted area. You know, if you have the opportunity, it's always better to park as close to the business or that you're going to be patronizing. There's not as much opportunity to be victimized in that parking lot. But with the lighting there, it's, you know, criminals tend to like to have the dark. They want to cover up their crime. They don't want to be seen when they're committing these crimes.
Definitely. You know, and the other thing too is if you have a question, you can call your local law enforcement at any time. If you're working with Embrace Hospice, you can check with your folks that are coming in and out. And if you feel like something is just not right, chances are your gut is probably accurate on that. Call and check. We talked a little bit about having home repairs. If they don't have reputable credentials, you're not sure about them, go ahead and give them a call. It's something that we definitely want to make sure of. So, Sergeant Benton, Lieutenant Harrelson, and April, thank you so much for joining us. We appreciate having you. The bad news is, folks, we've got so much to talk about with this situation that we're going to have another show. So we will be bringing you more on senior safety issues. We have this show every Friday right here on WMBF News. It's called Embracing Senior Health, and we're here for the seniors to give them great information about staying safe and about the things they need to know about in this community. We'll see you next week right here on WMBF News at noon.